Hello, I'm Dr. Tracy Paschke with Heart Health Prevention and Wellness, and I'm a preventive cardiologist helping people prevent and reverse heart disease. So today I wanted to talk about insulin resistance. So you may have heard this term, and it's somewhat related to diabetes. It's kind of the first sign that somebody may be on the road to getting diabetes, so I wanted to spend a little time to talk about it specifically. Insulin resistance is a metabolic disorder that is associated with increased health risks. So there's a direct impact on cardiovascular health, which is why it's important for cardiologists to discuss with people. It's characterized by the body's diminished ability to respond to insulin. Insulin's a hormone that's released by the pancreas in response to blood sugar, so it's responsible for regulating blood sugar levels and facilitating blood sugar or glucose entry into cells for energy. So when the body becomes resistant to insulin, higher levels of both insulin and glucose build up in the blood, and that sets the stage for various health issues, including type 2 diabetes and heart disease. So what is insulin resistance? Insulin resistance develops when cells in muscles, fat, and the liver start responding poorly to insulin and can't easily take up glucose from the blood. So as a result, the pancreas produces more and more insulin to try to get the cells to respond and take glucose into the cells. And the excess insulin might eventually be ineffective at lowering blood sugar levels, so the blood sugar levels remain high. Why does that matter? Well, the importance of addressing insulin resistance lies in its role as a precursor to several chronic conditions. So primarily it's one of the earliest signs of developing type 2 diabetes. Also, insulin resistance is closely linked to a cluster of conditions known as metabolic syndrome, and these other conditions include high blood pressure, high blood sugar, excess body fat around the waist, abnormal cholesterol and triglyceride levels, which all can significantly increase the risk of cardiovascular disease. So preventing and managing insulin resistance is crucial for maintaining overall health and avoiding progression to these more serious diseases. So some key strategies include, number one, diet. So adopting a balanced diet rich in whole foods, fiber, and healthy fats can reduce insulin sensitivity, and limiting processed foods, saturated fats, refined carbohydrates, and sugars are also beneficial. We want to be more physically active. Regular exercise helps muscle cells use blood sugar or glucose for energy, improving insulin sensitivity, and a combination of aerobic and resistance training is recommended. Third, weight management. Reducing body weight, especially weight around the waist, so that's visceral fat around the abdomen, can significantly enhance the effectiveness of insulin. Next, we want to focus on adequate sleep and stress management. Inadequate sleep and high stress levels increase inflammation in the body, which can contribute to insulin resistance. There's no specific test to measure insulin resistance, but several tests can give us clues. Blood tests like hemoglobin A1C, which measure average blood sugar over the past 2 to 3 months. We can directly measure insulin levels, which are helpful. And we can do continuous blood glucose monitoring. So that's a little device that you put on your arm, and it continuously, automatically measures your blood sugar over the day and night. And by using that, you can see how your blood glucose levels are affected by different things you eat or drink. And you can review how your blood sugar levels changes over hours or days, and you can get trends. So treatment options, lifestyle modification is the cornerstone for managing insulin resistance. But it's important to remember that sometimes people will need medications. A commonly used medication is metformin, which can significantly improve insulin sensitivity. Consulting with your doctor is essential for a treatment plan tailored to your needs. The connection between insulin resistance and heart disease is mediated through several risk factors. Again, these often occur together. Insulin resistance can increase triglyceride levels, it can lower HDL levels, which are the good cholesterol levels, and it changes the composition of LDL cholesterol, causing more small atherogenic particles. And all these things are risk factors for atherosclerosis or plaque buildup in arteries, which is a major underlying cause of heart disease. Also, insulin resistance is often associated with chronic inflammation, which again is felt to play a central role in atherosclerosis. So insulin resistance is a complex disorder with significant implications for cardiovascular health. However, by making a few lifestyle changes and considering possible medical intervention if needed and regular monitoring, you can manage insulin sensitivity and reduce the risk of associated diseases. Early detection and proactive management of insulin resistance improves quality of life and reduces the healthcare burden associated with its complications. So by understanding, detecting, and managing insulin resistance, we can take responsibility for our long-term health and well-being, and it helps us to feel more empowered and proactive in managing our health. So if you need help, you can contact me at www.hearthealth.care, or you can email me at drtracy, drtracy, @hearthealth.care. All right, see you next time.